Today we are going to discuss about sensory supply of face, and I have drawn this diagram showing the sensory supply of the face. As you can see in this diagram, face is supplied by the three divisions of trigeminal nerve except the angle of mouth and parotid gland. Angle of mouth and parotid gland or skin over that area is innervated by great auricular nerve. So one by one we are going to discuss these three divisions of trigeminal nerve, and following are the divisions of trigeminal nerve: ophthalmic division, maxillary division, and mandibular division. So first of all, let us discuss about the ophthalmic nerve. Ophthalmic nerve gives 5 branches that innervates the skin over the forehead, upper eyelid area, side of the nose. So let us discuss these 5 branches one by one. Following are the 5 branches of ophthalmic nerve: supratrochlear nerve, supraorbital nerve, lacrimal nerve, infratrochlear nerve, and external nasal nerve. As you can see in this diagram, lacrimal nerve innervates the lateral part of the eyelid. Then comes supraorbital nerve. As you can see in this diagram, supraorbital nerve is also a branch of ophthalmic nerve. It innervates the central part of the eyelid, and it also innervates the skin of the forehead. Supraorbital nerve, as you can see in this diagram, winds around the upper margin of the orbit at the supraorbital notch, and then further divides into branches that innervates the skin of the forehead and central part of the eyelid. Then comes supratrochlear nerve. As you can see in this diagram, supratrochlear nerve is present medial to the supraorbital nerve, and it innervates the medial part of the eyelid and also the lower part of the skin of the forehead. This supratrochlear nerve, supraorbital nerve, and lacrimal nerve, all three are the branches of the ophthalmic nerve. Then comes infratrochlear nerve. Infratrochlear nerve innervates the skin over the middle part of the upper eyelid and also the side of the nose. External nasal nerve, as you can see in this diagram, innervates the side of the nose as far as to the tip. Now comes the second division of the ophthalmic nerve, which is maxillary division. There are 3 branches of the maxillary nerve. These are zygomatico-temporal nerve, zygomatico-facial nerve, infraorbital nerve. Maxillary nerve basically innervates the skin on the posterior part of the side of the nose, lower eyelid, cheek, upper lip, and the lateral part of the orbit. First of all, infraorbital nerve, which is a branch of the maxillary nerve. As you can see in this diagram, this is infraorbital nerve. It enters the orbit, it passes through infraorbital foramen, and after passing through the infraorbital foramen, it enters into the face, and it innervates the skin of the lower eyelid, side of the nose, cheek, and the upper lip. Then comes zygomatico-facial nerve. As you can see in this diagram, zygomatico-facial nerve passes through the foramen, which is present on the lateral side of the zygomatic bone, and after passing through the foramen, it basically innervates the cheekbone or the prominence of the cheek. Zygomatico-temporal nerve, it basically, as the name is telling, it innervates the skin over the temporal region. Now comes the third division of the ophthalmic nerve, that is mandibular nerve. Mandibular nerve gives 3 branches. These are buccal nerve, then is mental nerve, and then is auriculotemporal nerve. This is auriculotemporal nerve. So these 3 branches are given by the mandibular nerve. Mandibular nerve innervates the skin of the lower lip, lower part of the face, temporal region, and part of the auricle. Then it passes upward to the side of the scalp. Mental nerve, which is a branch of the mandibular nerve, it emerges through the mental foramen, and it innervates the skin of the lower lip and central part of the chin. Then comes buccal nerve, which is also a branch of mandibular nerve. It emerges near the anterior border of the masseter muscle and it basically supplies the skin of the cheeks. Then comes auriculotemporal nerve, which is also a branch of mandibular nerve. It innervates the skin of the auricle. It also innervates the skin of the external meatus, outer surface of the tympanic membrane, and skin of the scalp above the auricle. So this region is innervated by auriculotemporal nerve.